Now you have that patient of phobia walking in your clinic, and when he enters, he gives you a history of that particular kind of symptomatology that he develops that are quite indicative of a panic attack in that particular individual. He'll give you a history that he has that raised heart rate, he suffers from sweating, blushing, and tremors, or he basically develops a fear of extreme vomiting or an urgency to basically defecate or urinate. So all of these are symptoms towards the development of a panic attack. And then he also gives you a particular repetitive history of a stimuli in which he develops that panic attack. So you'll diagnose that person with suffering from phobias, that he's suffering from that particular kind of phobia. You can classify them according to the type of the triggering factor, depending upon the agoraphobia, or either it is the claustrophobia, it is the social phobia, or whether it is a phobia towards a specific object that he has developed. So taking the history is again the mainstay over here. Treating such patients or managing such patients basically depends upon the fact that you will start off with a complete and a detailed history taking. While taking down the history, you're going to pinpoint the risk factors that he has developed or he has in his history, and those risk factors can be highlighted while you are taking that history into your account. Clinical assessment is what is going to categorize how you're going to categorize that patient, whether he's suffering from a severe, mild, whether he's suffering from a moderate or a severe kind of a phobia. The symptoms have to be assessed. If he has walked in with those symptoms, you can assess them right on the spot. Or if he is basically giving you a recount of that incident that took place previously, a day before, or whatever, then you're going to basically counsel and get the maximum details from that patient as well. History taking, obviously the normal points that we usually consider that consists of the personal history, the substance misuse, the family history, the relationship history is again very important. That will basically highlight the problems that he has of the social kind. If he is a social person, if he has that morbid personality in which he's antisocial, that will basically highlight the factor that he is basically prone to developing these social phobias that can be there in that particular person. He is particularly housebound. He doesn't move about in the society due to the fear of the pessimism that he has developed through his life experiences. So it's again very important to consider these factors and get a detailed history from the person himself or herself. The assessment of comorbidities is again very important in these individuals. You will consider what comorbidities exist in these individuals. Now, talking about the comorbidities, it can be of the organic kind and it can be of the psychiatric kind as well. The person may be suffering from depression or the bipolar affective disorder, and basically these conditions can coexist eventually. Even phobias are seen in the schizophrenic patients or in patients with these split personality disorders. So these kind of phobias usually develop with the passage of time. Now, the other key features that have to be assessed in that particular patient of phobias, all of this will be discussed in this section quite comprehensively. Talking about the assessment of these patients is again very important over here. To establish the presence of the phobic anxiety is again very common over here. We have to have that particular self that this is basically an anxiety attack, this is basically a panic attack that the person is suffering from, and to identify the nature of the feared situations. So the stimuli or the triggering factor has to be highlighted in those repetitive situations. Not a single attack is enough to identify these situations. So you'll get a complete history of any other panic attack that he had suffered from in the past, and then you'll compare those incidents along with them. If there are multiple incidents, good enough, well enough. But if there are one or two incidents that took place, then you're going to compare those incidents and get on to that triggering factor that is basically triggering that panic attack or anxiety situation in that particular person. And then look for the associated psychiatric symptoms. Is the person suffering from depression or mania, or it it is a bipolar affective disorder. All of these has to be considered in that particular patient. And you have to consider the variety of the treatment options. Talking about the treatment options, it can vary from just counseling to the CBTs, that basically in which we variate these counseling sessions along with the pharmacotherapies or with the medications, and we get a very good result out of these. And then we can have the individual medication therapy as well to control the anxiety effects. Now, establish the phobic nature of anxiety is again very important. What is the nature of anxiety, and classifying this anxiety is again very important. Whether it is the social phobia, or it is the agoraphobia, or it is the phobia towards the specific objects. And when we're talking about the specific objects, it can be the phobia to the height, to the water, or it can be phobia to the social relationships, or the dental treatments, or the medical treatments, blood, or the blood transfusion. All of these can be a triggering factor in a particular patient. The confirmation of the episodic anxiety is usually done by taking a recount of the symptoms that the patient suffered, especially the increase in the heart rate, increase in the respiratory rate, then the retrosternal pain. It can be the difficulty in breathing or difficulty in swallowing. All of these are basically the features of a particular panic attack. Then the sweating phenomena is usually seen. The person gives you a history of an urgency of defecation or urination, or an urgency of vomiting. So all of these are the symptoms of the anxiety attack. The distinguishment between the agoraphobia, social, or the specific phobias is again very important when we are distinguishing such patients. And the phobic anxiety has to be taken in account in these individuals as well. The phobic anxiety, what is the severity of this phobic anxiety? It's again very important. Classifying it into mild, moderate, and severe forms is what we're talking about over here. Then secondary to other psychiatric diagnosis, it's again very important over here to diagnose the other psychiatric ailments that the person can be suffering from, and the clarification whether the anxiety is of the primary kind or of the secondary kind, secondary to another psychiatric ailment. It can be due to some delusion, or it can be due to some hallucination that he develops that panic attack. And then inquiry about the time of the phobic anxiety. What is the triggering factor is the mainstay over here, what we're focusing on over here. So to get on to that triggering factor is the point that is going to heal the patient through counseling or through the medications, or all of these psychiatric medications basically depend upon finding out what is the triggering factor in that particular patient. The assessment of the comorbidities basically consists of the depressive illness or the depressive symptoms that a person can have, or without history of the phobic anxiety, the amount of the impairment, how much his functionality is being affected in that particular case. The obsessive compulsive disorder sometimes coexists with this phobias, and the substance misuse is again seen in a lot of individuals. And to avoid confusion with other disorders, we have to get on the history in quite a detail. The other key features to assess are the degree of distress, the loss of function by the symptoms, and the motivation of the person to preserve with treatment. Cognitive therapy is usually it is how dealt on with, and the degree of performance, how it is affected. The fear that the people are judging that particular person in negative ways is again very important in that particular person. So the assessment of the person with phobias is again very important, and how do we do it? That is described in this section. That is the end to this section. Thank you for watching sqadia.com.